In my last month of my medical school career, I had the opportunity to travel to Malawi for one of my med school rotations. I was placed in the OB-GYN ward, and as a naive medical student out in the field, I imagined myself delivering babies and saving the world. That's the dream, right? In those 5 short weeks, however, I left the country with more to reflect on than what I thought I was offering. My time in Malawi would reignite something deep within me that went missing in med school, especially during my hardcore studying for 12 hours and still trying to stay sane days. What my Malawian experience taught me was the importance of remembering that the fundamental truth to our humanity is each other. Reflect on a time when you just felt connected. Not the superficial rom-com kind. I mean truly seen, heard, and valued. There are moments in life where you connect with another human being on a very deep level. It may be a breakthrough with a sibling, sharing a vulnerable moment with a therapist. How about an honest conversation with a complete stranger in a McDonald's bathroom where you just are friends? True story, by the way. My connected moment was in Queen Elizabeth Central Hospital in Blantyre, a city in Malawi. Now, one thing that makes medicine in Malawi vastly different from America is that some of the patients that present to the public hospitals live in villages below the poverty line. They embark on the hours-long journey to the hospital into the city. Then, they remain there for weeks, even months, awaiting their workup. Whether it's obtaining labs, getting a biopsy, a surgical procedure, maybe even getting a CAT scan. Now, mind you, there is still only one CAT scanner in all of Blantyre, and even that only sort of kind of works. These patients aren't able to go back home because, well, they don't have the means to return. Many of these patients are there for weeks by themselves. Maybe they're scared, apprehensive, doubtful. But you know what they aren't? Alone. Every morning I would walk into the OB-GYN ward and I would see new faces of new patients. But they didn't act like they were new. There was almost a camaraderie of sorts, where these women just looked after each other. They were laughing, sharing each other's food, comforting each other. They gossiped about things that I wish I could understand because I didn't speak the language. Women who were fortunate enough to get a bed in the ward shared with women who were sleeping on the floor because there just weren't enough beds for all the patients. Their solidarity in its purest form was effortless. I also noticed that the Malawi med students actually had time to sit with their patients and chill with them. Because we work closely with the local med students, we kind of kicked it with our patients too. We learned a lot about our patients by bringing down our medical persona, that guard that we always have up. And we talked to them on a personal level, really getting to know them, where one pregnant mom, she wanted me to name her child. We got very intimate with the patients. I was taking care of a patient who had recently been diagnosed with stage 4 cervical cancer. She had been in the hospital for a few weeks, waiting for her diagnosis and possible treatment. The biopsy returned, and her cancer was inoperable. She was told she only had a few months left to live. I can't even begin to imagine what was going through her mind. But from the outside looking in, you would have never guessed that she just received a terminal diagnosis. She continued talking to her fellow hospital mates and laughing with her 10-month-old in her arms. As we were talking to her and playing with her son, she looked up at one of the local med students and out of nowhere told him to give her child. Honestly, we didn't really understand. She barely knew us, yet had faith that he would be taken care of with us. Without sharing a language or culture, she felt that fundamental human connection. She was willing to entrust us with her own son, her flesh and blood. Don't worry, guys, I didn't take her up on the offer for this adorable son. But that's human connection, isn't it? It's a rare commodity these days in America. It's still out there, but we're losing our grasp on it. Now, when I came back home and started my family medicine residency training, I found myself constantly reflecting on my experience in Malawi. Furthermore, I found myself reflecting on my own experiences of community engagement throughout my med school years here in Detroit. What was it about those emotions that I felt, and why was it consistently missing in our healthcare here? We have one of the strongest healthcare systems in America, with amazing resources, technology, and pretty good health outcomes. Despite that, there are so many individuals willing to share a personal story about poor bedside manners by a staff, nurse, physician. Patients will complain their doctor was unempathetic, aloof, detached, or one of the worst complaints, the doctor barely spent time with me. We have a problem in our healthcare systems. As a young physician, I noticed that yes, although we were taking good care of our patients, we also were not taking good care of our patients. Let me explain. Gallbladder surgery is such a common and routine procedure in the medical world that we don't even blink an eye. But it's still surgery. To a patient who has no medical background, it can be daunting. I can manage an infected gallbladder. The meds we use, the imaging we order, the consulting services we seek, there's a written protocol for all that. But what we're not taught as well is how to tackle the anxiety in our patients leading up to the procedure. Anxiety about anesthesia, breathing from a tube, or really, how about the anxiety of cutting up your skin and actually removing a whole damn organ? I can manage a foot infection on a homeless individual because he was walking in the wet snow for hours, maybe days, and putting himself at risk for a frostbite with eventual amputation of his foot, but I dare not hold his hand and comfort him. Why is it that our outcomes on cancer and heart disease can surpass other countries, but our mental health diseases are skyrocketing? An all-time high, 30% of Americans were diagnosed with anxiety and depression just in the past year. With suicide as the number 2 cause of death between the ages of 10 and 35. Let that sink in for a while. 10-year-olds in America are taking their own life. One of the problems in America's health system is the lack of community. We have disconnected. Us healthcare staff and them, the patients. We're failing to connect with our fellow human beings. When we studied medicine, we ultimately forgot humanity. While brutally learning every organ system in our bodies and its relation to one another, we somehow missed learning about the mind and soul 101. How to see, how to hear, how to value people. The human connection. That was until COVID. In a state of pure and utter chaos around the world, we somehow drifted back to our human core. The concept of human connection was back, but this time it was wearing a mask, sanitized, and stood 6 feet apart. Working in a Detroit hospital, one of the main epicenters of Michigan, during a worldwide pandemic was humbling. It was one of the first times in my healthcare career that I actually felt somewhat of a community forming. We were a united front against a microscopic enemy. There were healthcare workers comforting each other, helping out with the personal protective equipment. Doctors, nurses, and respiratory therapists covering for each other's shifts out of pure exhaustion. We felt that connection, especially when community members donated masks to hospitals. When we saw footage of children collecting sanitizers from their neighbors and dropping them off to local clinics. It was heartwarming. Working in the intensive care unit was a little different. I unfortunately experienced terminally weaning patients off of the ventilator. That's basically when we turn off what is known as life support. So pre-COVID, when we terminally weaned a patient, we would invite all the family members to gather around the patient. Sometimes there would be music playing, maybe a chaplain present, all of this to help the family ease the transition of their dying loved one. However, during COVID, as families could not be present during this solemn moment, we would call them on FaceTime and hold the patient's hands for them as we turned off the life-saving machines. One time, we were weaning off a patient who had been a part of our ICU team for about a month. Her medical health was decompensating, And there came a point where the family had to make the tough decision to make her DNR. Do not resuscitate. The whole medical team took her to a separate room for privacy. We used our phones to have the family on FaceTime, and as my fellow residents started the process of terminally weaning, removing her breathing tube, one of the nurses grabbed our hands as well as the patient's and started reciting a Christian prayer. I'm not even Christian, and she had me welled up in tears. Even within our head-to-toe covered PPEs, I felt connected to everyone in the room. The current environment in our healthcare system is more or less rough. We need to invite change into this system. But of course, I'm not talking to an audience of healthcare workers. I'm not saying you have to go to Africa or become a doctor to feel connected to those around you. It just shouldn't have to take a pandemic for us to seek connection. Looking into the horizon of our future, I hope we can all look deep within. Ask ourselves, what can I do in my life to connect with someone else? How do we start to form that community that we also desperately need to survive in this world? Early on in the pandemic outbreak, we had a patient who was one of the first COVID patients. He was immediately intubated and sent to the ICU. I joined his medical journey about a month and a half later. I remember walking into his room and seeing him on the ventilator and medications through his IV that were pretty much keeping him alive. After about 1 to 2 weeks, however, he made a turning point. One day, we were ready to extubate him. The team inside the room removed the tube from his throat, and as we waited in anticipation, he started breathing on his own. First thing he did was turn his head to the left, and you know what he saw? A group of ICU staff and caretakers gawking at him through this glass door, cheering him on, giving each other the COVID elbow shakes. He sheepishly smiled and raised his thumb to give us a thumbs up. To be honest, I don't think he knew he had COVID at the time. I don't even think he knew what COVID was at the time. He didn't realize why we were so excited. You see, he was one of the first few patients who had become a COVID survivor. And at that time in the world, we didn't know what was to be expected. Despite all that fear, we found hope in him. All he felt was this human connection. In fact, we all